other model we mentioned. It's a draft federal government model based on preliminary data, and it warns of dire consequences if reopening is not done with proper care. The scenario planning information, as it's known, is based on research developed by Johns Hopkins, and it says average daily death toll from this virus could nearly double to 3,000 by June 1st. President Trump has been publicly encouraging states to reopen, of course. Paula Reid is at the White House for us. Paula, good morning. What is the president saying about all this?
Good morning, Tony. In an interview last night with the New York Post, the president said he's never seen this document. But the researchers who did this analysis say their data was preliminary and it wasn't supposed to be used to make predictions. But they do concede that there are some scenarios, especially if social distancing is eased too soon, that could result in a significant increase in the number of people who die from coronavirus.
President Trump called the document fake. But CBS News has learned the slide presentation is based on preliminary analysis developed by researchers at the Johns Hopkins School of Public Health and presented to FEMA. In a statement, the school said the results were not to be used as forecasts, but illustrate that some scenarios, like relaxing social distancing too soon, are likely to cause significant increases in COVID cases and deaths in the U.S. Dr. Anthony Fauci said that while models can change based on the assumptions entered, the core principles don't.
People. When you have mitigation that's containing something, and unless it's down in the right direction and you pull back prematurely, you're going to get a rebound of cases.
And while the president dismissed the FEMA document, even the White House's preferred model, the IHME, has nearly doubled its prediction of lives lost. And over the past 2 months, the president has repeatedly revised his estimate.
It's looking like it's heading to 50,000 or more deaths. It looks like we'll be at about a 60,000 mark. We're going to lose anywhere from 75, 80 to 100,000 people.
CBS News chief medical correspondent Dr. John LaPook says models are useful for policymaking.
The coronavirus pandemic is one big moving target, so it's not at all surprising that as the data changes, the projections are going to change. The important thing is to look at those changes in the projections and say, maybe I should alter my strategy if the projections are different than I thought they were going to be.
The Trump administration, though, seems unmoved by these dire new predictions. A top White House advisor told CBS News yesterday they believe that these new models actually support what the administration has done so far. Now, later this morning, the president will head to Arizona, where he will tour an aerospace factory that's been converted to make personal protective equipment. Gail?
All right. Thank you, Paul. The big question today, will the president wear a mask? We'll see.